The National Pediatric Readiness Project started about 3 decades ago. It is a collaborative effort between the American Academy of Pediatrics, the American College of Emergency Physicians, the Emergency Nurses Association, and the Federal EMS for Children program. And these organizations have been working collaboratively, and I would say alongside the work that Phyllis Rabinowitz, Our Baby, and other organizations have done. These organizations have come together through a national quality improvement effort to improve the capabilities of our pediatric emergency care system. And because of the high level of engagement of frontline healthcare providers, there's a lot that we now know about the state of our emergency care systems to meet the needs of children. First, we know that over 80% of children are seen in non-children's hospitals. 70% of emergency departments see fewer than 10 children per day, meaning that the exposure that every ED has to the most critical or injured child is relatively infrequent. Over 90% of children have access to emergency departments, which is great. However, over 90% of those children live closer to a non-pediatric ready emergency department than one that is indeed pediatric ready. There is a 60% decrease in mortality for injured children who are seen in pediatric ready centers. There is a 76% decrease in mortality for ill children who are seen in pediatric ready emergency departments. We also know from the National Pediatric Readiness Project work that when a child unfortunately does succumb to their illness or injury, that the median time to death is only about 3 hours. And that means that there's simply not enough time to transfer that child to another center, and why every emergency department must be ready to immediately stabilize and resuscitate a child if the case may be. And so the gaps that we've identified in these national assessments have resulted in a tremendous number of efforts, both at the national, state, and local levels, from the development of educational tools and resources, national quality collaboratives, evidence-based practice guidelines, policy safety recommendations, the establishment of quality measures and systems performance measures. We've also done a tremendous amount of work when it comes to workforce development and how we can integrate pediatric readiness efforts into organizational goals. But despite all these efforts over the last several decades, there's still a tremendous amount of work to be done.